In this lecture, we're going to talk about NCLEX style questions, which is something that every student coming up to the end of their nursing program is very concerned about. So I decided to go into this today in order to help those students that are getting prepared to take the NCLEX. Welcome to CAS-RN, where I teach you about all things nursing. In this lecture, we are going to discuss how to dissect an NCLEX style question, keywords that you need to learn, a question recipe, the different parts of each question, and various prioritizing strategies. So as we go into this, forget what you think you know about testing because you're wrong. I once had a nursing instructor tell me that 2 right answers is good, but 3 is better. Basically, you cannot answer NCLEX style questions with memorization alone. Nursing questions are completely different than any other question that you've ever had. You have to know the content, but you also need to know how to dissect the question. When I was in nursing school, I was getting so frustrated with these various NCLEX style questions, and I did have this instructor tell me that 2 right answers is good, but 3 is better, which is very confusing and frustrating, and I was irritated, but I'm going to show you some of the tips and tricks that I learned and how I passed the NCLEX my first go with the minimum number of questions. So to start off, dissecting a question. What I needed to do is to make sure that I would rephrase the question and write it down to help me dissect it better. And then, so I would write it down on my scratch paper and make sure that I was completely understanding what the question was asking. For me, I'm a visual learner. I prefer to see things. That's how they stick in my head better. So writing it down on a scratch paper was helpful for me, and it also helped me slow down because I have a competitive spirit and I wanted to finish faster than everybody else. But what you're going to realize is that honestly, it doesn't matter how long it takes you to take the test. It doesn't matter if you get the minimum number of questions. It doesn't matter if you get the maximum number of questions. What ultimately matters is that on the end of this, you're going to have your nursing license and that you are a good nurse. So for me, writing it down was helpful, but it's important for you to understand how your brain works in order to be successful, and not only successful in nursing school, but also in your lifelong pursuits. So make sure that you read the entire question slowly and carefully. Read the answer options and make sure that you know what they're asking. Do you understand? Read all of the answer options and make sure that you also understand those. And if you need to stop and write those down and rephrase it in a more simple way, do so. Look for keywords, which we'll cover next, but identify if the query is negative or positive. For example, which action should the nurse do first? That's a positive query, which means that you need to find the right thing to do. Versus if it said which action is the lowest priority, this question is asking for the least important thing or the wrong thing to do for the given scenario. Remember that more than one could be correct. So go through each answer and find out why it's wrong. This is a great way to eliminate 1 to 2 answers. So the process of elimination is definitely the best way. Don't find the right answer because if more than one is correct, you're going to get the answer wrong. Go through and find the wrong answers first, and then practice, practice, practice. Practice makes perfect, and you need to practice a lot. One thing that was really important to me and that I cannot stress enough is to never ask what if or add more to the question than is given. When in school, you learn about all the various scenarios, the what ifs, the maybes, and the what to do if those happen. But a nursing question is never going to give you more than what they're expecting you to answer. So it's very important that when you're answering those questions to never add more to the question than is given to you. Think of it this way. If you had a patient in real life that was stable with normal vital signs and they were getting ready to discharge, would you start CPR on them? You would not. Can you imagine the look on your patient's face if you threw them down on the floor and started doing chest compressions? Not to mention what your coworkers would think. That you'd probably get admitted to a mental health facility. I know that this is an extreme answer, but hear me. It's easy to overthink test questions because you've learned about all of the scary things, but you need to stay within the parameters that you have at that moment in time. Is it possible that your stable patient might have a heart attack 2 seconds after they walk out of the hospital doors? Yes, it is. But is that possibility going to affect your actions upon discharge? No. Everyone would think that you were crazy, and they would be right. Treat your test questions the same way. Don't add more than what is given, and don't ask what if or it depends. These questions have been tested multiple times. They've given you the information that you need in order to answer it correctly. So let's talk about some of those keywords that you might find. Basically, this is just going to be a dictionary of words that they're going to throw into test questions, and you need to make sure that you understand what they mean. So we've got ascertain. This means that you need to look for more information. Assess. The best, which means what's the best choice. This is common because there's often more than one option that could be correct. To check, which means you need to gather more information or double check something. To collect or determine. An early or a late sign of a disease is also something that I've seen a lot. So an early sign would be early onset, or a late sign would be something where this disease has progressed more. Essential, find out, first, gather, the goal has or has not been met. To identify, an immediate action that a nurse might need to take. Initial, again meaning first. To monitor, which would be the most, and you're usually going to say something like most appropriate, most important, or most likely. Need for follow-up. This is going to indicate that your patient needs to still do something, needs more education, or needs to follow up. Or again, like I said here, for more education. What's the next thing you should do? You need to observe, obtain. The primary thing that you should do, or priority. Your patient is ready for discharge. This is going to indicate that they're a stable patient that's ready to go. The nurse needs to recognize. The patient needs to understand, or something that is vital or essential. So go through and look at keywords and understand what those are going to mean. Like I said, a lot of these mean the same thing, but you need to recognize those in a sentence in order to be able to see what your prioritization strategy needs to be. Now let's talk about the question recipe. First off, we're going to have a scenario. This scenario is going to be the client or the situation that's going on. It's going to have a few pieces to it, which are going to include age, gender, diagnosis, and a modifying phrase. Age and gender are basically irrelevant unless, of course, you have a pediatric question, and then age is very important. But for other types of questions, you can basically ignore age and gender. Think about it this way. Is a male more important than a female, or a 30-year-old more important than a 50-year-old? I know that there's some ethical implications here, but we're not going to get into those right now. We're just talking about basic med-surg scenarios. So if you have two identical patients, you've got this modifying phrase, and that's going to be very important because that can be what sets them apart. Diagnosis helps us know what we're talking about, but again, like I said, the most important part of the scenario is the modifying phrase. Pay close attention to what it's modifying. Which is more important, a chest pain or a chest pain with an abnormal EKG? That modifying phrase is a huge clue into finding the right answers. So next up comes the question, and this is where you need to look again for some of those keywords. Is it a positive query or a negative query? Do you need to assess, identify, or act? After you've read the question carefully and you've paid close attention to that modifying phrase, you've identified the query and you've found the keywords, you're ready to look at the answer options. Now what you want to do is go through each answer option with the same magnifying glass that you went through the scenario and the question. You're going to go through with the process of elimination. You want to eliminate the answers that sound the same, because if two answers sound the same, neither one is going to be correct. You want to remove absolutes. If you're going to see things like all, always, every, none, never, and only, those questions are automatically going to be eliminated because not everybody is always going to be the same. We definitely cannot generalize nursing because every body is going to react differently. Look for umbrella terms that might include more options. If there's one option that includes other options, then that one's probably correct. So as you're going through these, make sure, again, you use those prioritizing strategies. So those prioritizing strategies include the nursing process, the ABCs, Maslow's hierarchy of needs, and then one that's my personal favorite is sick or not sick. The nursing process is basically just add pie. So we've got assess, do we need to gather more data? Diagnose, do we need to formulate a diagnosis? Plan, which is planning care. Implement is carrying out the plan, and evaluating is did that plan or intervention work out? Sometimes the questions will ask us to gather more information. So we're looking at a keyword that's saying to gather, or then we've got to formulate a diagnosis. What does this patient have based on symptoms? We need to carry out a plan, which is implement, and we need to make sure we're prioritizing our care. What would be more important? And then evaluate. Did that work? Another one that's very common that most people have heard of are the ABCs. This is just airway, breathing, circulation. So airway, can the air pass effectively through the lungs or into the lungs? Breathing, is the patient actually breathing? And circulation, is the heart beating or is the patient bleeding? Because if they're bleeding out, that's a very important thing that we need to make sure we take care of before we move on to other things. Also, when you look at things like this, make sure to prioritize your patient over equipment, because it's easy to get stuck in the equipment, but make sure you're assessing your patient first and then assess the equipment. Maslow's hierarchy of needs is basically just a pyramid that helps us understand what we need first. So our patients are going to need physiological needs first. That means that their air, water, food, shelter, sleep, clothing, and reproduction needs need to be met before we can move on to safety needs. And then we're going to move on to love and belonging, esteem, and self-actualization. Most of the stuff that we're going to look at in nursing is going to be based on those bottom three. We might help people. Sometimes as a nurse, we can find social workers that can help with the love and belonging and kind of connect those. But we are really going to be dealing with those bottom two the most, with the safety and needs and the physiological needs, especially because as nurses, we deal with the physiological needs. Are their bodies working the way that they're supposed to? Just recognize if you get a question where the physiological needs of a patient have not been met, then they're not going to be able to move on into anything else. Then sick, not sick. When I used to work as an EMT and I went to a training once and we talked about how do we recognize in a multi-casualty incident which patient is going to need the attention, or how quickly do I need to get this patient and put them in the ambulance and run to the hospital. So how do we prioritize basically one patient over another? So I went to this training and the guy called it sick, not sick. And I've added some more to this, but this is the general idea in how to prioritize some of those patients. So if a patient is sick, we're going to go through the sick category first. If it's something that's an acute onset. So if I was an EMT and I rolled up on a car accident is an acute onset. This is an emergency situation. I need to do something quickly. In a hospital setting, if they were admitted less than 24 hours ago, we're going to consider them sick because we don't know for sure how their body is reacting to what's going on right now. If we've got atypical symptoms with somebody that's coming on, so let's say we've got somebody who's got strep throat and they are having difficulty breathing. That is an abnormal reaction, and we want to make sure that we're looking at that and we're doing something to deal with it. If we've got a changing assessment, so this is going to be things like our vitals. Our vitals are not maintaining a stable trend. If their level of consciousness or their orientation is changing. So let's say they're alert and oriented ×4 when you go in and assess them, and then a few hours later you go in to assess them again and they're alert and oriented ×2. They don't know where they are and they're not sure what time it is, or maybe they don't even remember their name. That's a decreasing assessment and something's going on that's making them so that they are sick. If they're not breathing, or if they don't have a pulse, or if they're hemorrhaging. These are all things that are going to change your assessments, but they're all emergency situations that we need to get taken care of. So remember back to those ABCs, airway, breathing, circulation. That's exactly what this is. No breathing, no pulse, and hemorrhaging. That's a big deal. And hypoglycemia, if they have a blood sugar that's very low, that can be life-threatening. So we definitely need to make sure that that gets addressed. If they have a recent surgery or procedure that's been done in the last 12 hours, that also, and then in addition to that, if they had general anesthesia, that's going to make you sick. And then anytime they use the word unstable, our patient is obviously going to be sick because they are not stable. Now, if we look at the not sick categories, we're going to kind of go along the same, just the opposite of those. If the disease is chronic, if they've been admitted longer than 24 hours, if they've got the typical symptoms for their disease, if their assessment is not changing, so that means that their vital signs are trending the same, their LOC and orientation are staying the same, they've had a surgery or procedure, but it's been longer than 12 hours, they're stable. They use the word stable. So I understand that people who are in the hospital for longer than 24 hours are going to be not necessarily not sick, ready for discharge. But when we look at prioritizing, our sick patients in the category of sick are going to be the people that we need to talk to and take care of first versus our patients that are going to be in the not sick category. And then one more thing that can help you figure out which patients are going to be more sick or not sick is just the order of organ vitality. These are the highest ranking 6 organs: the brain, lungs, heart, liver, kidneys, and pancreas. You can almost in a way think of this as if you start at the top of your head, kind of go down. You've got your brain, which is in your head, the lungs, if you count the mouth where you intake air, your heart's below them, and then the liver is below that. After that, you get into the kidneys and the pancreas, and whether one's higher or lower than the other actually physically, but it can help you remember at least those first 4: brain, lungs, heart, liver. And then after that, you can learn to prioritize a little bit more. So just a quick review. Make sure that you read each question slowly and do not add more than is there. Keywords are important in the query. Make sure that you understand each part of a question and how to utilize the question recipe to find the right answer. Review the various prioritization strategies to find the right answer, and practice, practice, practice. Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.